the demonstration of Nursemaid's elbow. During this technique, reduction is brief and may cause some additional discomfort and crying while performing the technique. Please advise the caregiver that this is an expected response, followed by the child being able to actually physically move the arm. This is best performed with the child seated comfortably in the caregiver's arms and the examiner seated facing the child. Standing is optional and it definitely can be performed. Sedation and pain medicines are typically not needed. However, if a parent requests a dose of Motrin or ibuprofen or Tylenol in the clinic, it is acceptable. We have two methods that you can use. It's supination method or pronation method. Per evidence, we recommend pronation first, followed by supination if unsuccessful. The pronation method, known as the handshake method, the provider will place pressure on the radial head with the thumb of one hand and then grasp the wrist with the other hand. You then hyperpronate the wrist, immediately followed by flexion of the elbow completely to the ipsilateral shoulder. Click may be felt by the finger over the radial head when the displacement is successful. You can always have the parent as well put a finger or a hand over, because sometimes them feeling that click is all the confirmation they need that you have done the right thing. Now let's demonstrate the pronation method on the baby K here. All right, he is comfortably in the caregiver's arm. You are in the seated position. You follow that radial area to the radial head. Let's go ahead and then we follow by flexion of the elbow. Again, we follow that radial track to the radial head. Hold pressure. You want to flex, cross across your body. Ipsilateral shoulder with flexion. For the second method, we'll be demonstrating the supination method. This should be performed if pronation is unsuccessful. You would start by placing some pressure on the radial head with one hand and then grasp the wrist with the other hand. Fully supinate that wrist, so fully supinate it, and then immediately flex the elbow completely to the ipsilateral shoulder. Again, you should feel that click or pop, and you can always put the caregiver's hand over your hands as they can feel that click as well. Now we'll demonstrate on baby K here. So we follow the thumb to the radial head. We want to completely supinate and then bend at the elbow. You should feel a pop or a click in that area. This can be felt and sometimes heard. Again, allowing the child just a little time. I recommend at this point, after you have successfully performed the technique maneuver, that you step out of the room about 5 to 10 minutes. Instruct the caregiver to allow the child to play, put him down, he or she down, let them walk around the room, try to hand them some things. If they have water or food, kids love snacks, so giving them a snack could allow them to hand. We want them to stimulate the child to move the arm. After about 10 minutes, I typically will re-enter the room, and then I start engaging with baby K. My favorite motion is high five, high five. Once you see baby K can give you a high five, you know you have successfully reduced that subluxation of the radial head.
Thank you so much for watching. If you enjoyed this, there's plenty more where that came from. Be sure to check out similar videos on our YouTube page. And don't forget to like, comment, and subscribe, and we'll see you next time.